Hello, my name is Kitu Jhawar-Terris. I am one of the coordinators for the School Mental Health and Grief Services programs at Social Advocates for Youth.
Hi, my name is Debi Emmons, School Mental Health Coordinator with Social Advocates for Youth. In our school-based program, our trained mental health clinicians provide brief, strength-based, trauma-informed sessions to at-risk students in our Santa Rosa City schools.
One of the greatest assets of our program is that we meet with students where they are. Typically that would be at their school site, but during distance learning, this means that we're meeting with students that might be at home or in another private space. Our clinicians are also oftentimes the only mental health providers on campus, so they're really in a unique position to be able to support and recognize some of the youth that might be at risk. And also, due to the nature of our program, we're also reaching students from a variety of different backgrounds and are working to reduce the stigma of seeking out mental health services.
One of SAY's core values is to meet the youth where they're at, and SAY's mental health clinicians do so with passion, with intent, with education, and with heart and hope to our students of Sonoma County.
One of the ways that we've adapted to the pandemic is that we've been providing that support via telehealth. So that means via a video or phone session. And we found that 75% of the referrals that we've received this school year are for students who have been experiencing a sad, depressed, or irritable mood. And 50% were referred for low or decreased motivation. So this really speaks to the struggles that students are experiencing with distance learning and how critical access to that support and mental health services are for our youth right now.
The youth's needs have changed, and we know that because they've told us so. They've shared stories of isolation and of having to share a room with 4 or 5 siblings. They've shared stories of depression and anxiety and sleepless nights and isolation. They've even shared stories of thoughts of suicidal ideation. At this time, more than ever, students need to know that they're not alone. Our young people are our future, and they need to have the moments where they can trust in themselves and their abilities to get through this. Our school-based clinicians teach them those skills. They teach them how to count on themselves and how to modulate their body and how to feel calm when they're upset so that they know that they can get through this, because all of us together will get through this.
Please become an advocate for SAY and help us support our youth.